Hello, everyone. This is Dr. Homer from Reproductive Science Center, and I just wanted to take this time from my daughter's bedroom, because it's the only quiet room in the house, take this time to let you know, give you guys an update on our fertility practice and how it concerns with COVID-19. So as you know, that in the Bay Area, there is a shelter in place announcement from all the counties. And so what this means is that we are needing to find a good balance between proper responsible social distancing as well as taking care of our patients who have a real need and time matters. And so we're trying to find a really good balance. And I think that we found a pretty good one at the moment. So I wanted to explain. The first part of this is that we are doing our best to limit the spread of COVID-19. That involves closing our satellite offices, working at minimal staffs or rotating staff, extra deep. We always do deep cleans anyways. People are like, how come now we're talking about washing our hands? We always wash our hands in the first place. But now we are doubling or even actually quadrupling down, honestly, about our deep clean amongst we in our office. We are screening patients, taking temperatures, only allowing no partners or children or anything else, just minimizing that contact. We're doing our best to the patients who are in treatment to finish that treatment as fast as quickly as possible, but also with good benefit. And we are pausing for the next couple of weeks, starting up new cycles. Now, we fully anticipate that we hope that this shelter in place will be lifted sometime in April. We don't know for sure. We are continuing to monitor the FDA, the CDC, the WHO, our local county health offices as well as the federal government's announcements and guidance, and hospitals and other IVF practice, everyone. So we are trying our best to find the balance. So our priority at the moment is to do our part for the greater good of which we all live in the Bay Area. These are our families. So we're doing our best to limit that by focusing on minimizing contact and spread of COVID-19 at the moment. We, of course, have being a fertility practice, we have a couple other things that we have to balance. We are an essential service. We are not as essential as the hospitals or the emergency rooms, of course, but fertility is recognized by the international community, by the WHO, as a medical condition, and one where time matters, right? And so we need to find that balance, and we're working with and following to make sure we can find the right balance for you guys. So at the moment, we are paused. At the moment, we also feel like we should be able to be back up and running sometime in April. And we are planning for this and ramping up for this to make sure that we can meet everyone's needs in the Bay Area. So if you're looking at this and you're wondering about us, we're not going to go anytime soon. And once the county and the law allows us to start to kind of ramp back up and allows us to, then we will continue to follow and let you know as soon as possible. You can feel free to obviously ask your doctor, send portal questions into your nurses, but we're monitoring and working on it. Another thing that we're dealing with, of course, is people are wondering about COVID-19 and pregnancy. The short answer is that we don't have any bad news about COVID-19 and pregnancy, but we don't have a lot of news. There's some case reports, and we have a little link on the website, but I'm sure you maybe read about this as well, that some of the women who have been infected with COVID-19 while in the third trimester of pregnancy in Wuhan, China, were able to deliver a healthy child. What we do know is that if you were to contract the flu, when a woman contracts it in the third trimester, has about a 25% chance of maybe being hospitalized. So while COVID-19 is not the flu, we know that, we have to assume that it would follow a similar model as the flu. And so having the COVID-19 co-infection with the pregnancy in the third trimester is not a good thing, probably, just like it's not a good thing to get the flu, which is why we have the flu vaccines. Vaccinations are encouraged. We have no evidence right now that it would cause any birth defects or that it would transmit vertically, which is when it comes from the mom gets it and then in utero through the placenta, the baby would get it. So we have no evidence of that right now, nor do coronaviruses in general do that. But of course, this is novel. This is new. This whole thing is just new. So we are following along. No organization currently in the US is saying that one shouldn't try to get pregnant. At the moment, we are pausing our transfers of embryos or intrauterine inseminations or ways to help people get pregnant now, but really just to get a bit more time for some more data to mature and for more observations and reporting, but also mostly just to limit these visits because we're just trying to keep our social distancing. That's our main goal right now. We do understand, of course, that there are other questions that can come with, this COVID-19. So supplies, like the labs, the embryos, they're doing fine. We've got plenty of supplies, even if it's extended. I mean, there's not like a siege outside, or there's not like another, but we are bunkered in. We have all the supplies that we will need, liquid nitrogen, the tanks, the embryos, everything is so far so good, even if this process goes on a little bit longer. Okay, so you can worry about it, but this is what we do, and we have it. Okay. We do hope to be up and running sometime in April. We will see how it goes. But just to kind of reiterate, we are focusing on one, social distancing, which we're doing our part for. Once we're allowed to mingle again, then we're going to start up our cycles again as well. We are going to start at least on a smaller capacity just to make sure that we have that we can still address the needs of our patients who have a very timely condition that we just can't wait forever on, right? Because that's also an important part about this. We are also focusing, of course, in thinking about pregnancy and COVID-19, which I kind of covered. There's the embryos in the labs and the safety of the embryos as well. And altogether, what we want you to know is that you're getting inundated with emails, and probably from like Chipotle too, right? You're like, oh, great, thanks, Chipotle. Now I know what you're doing for your COVID-19 protocol. But we are constantly we're all getting tons and tons of communications and emails and information right now. And with the 6 physicians in our group, as well as our executive team, we are monitoring all those ports of information, getting information and trying to summarize it and make it concise for you, unlike maybe this video at this point, so I'm sorry. But we're trying to balance thinking about COVID-19 pregnancy currently, thinking about social distancing, which is our main thing. And then when it's safe to do so, then we're going to be ramping back up here at RSC and doing our cycles just like we normally do. We will, of course, continue to practice all of the things that we should be doing in terms of, and encouraging you, of course, to also, we'll continue to be screening, continue to be looking for close contacts, maybe who are diagnosed with COVID-19 or suspected COVID-19. We will continue to be very diligent about our patients' health. So that's what I got here at RSC. Questions, you can call. We are open still and working 7 days a week. We are on a limited capacity, but all the doctors are still working. The staff that need to be are working. Those who work from home are working from home, but we are in the labs. We are in the office that we need up in San Ramon. And stay safe. Everyone knows that we should be washing your hands and staying away from people and keeping our social distancing. But I'm going to focus on one more thing. Make sure you wash your hands 20 seconds. Think about the last 2 times that you washed your hands today and ask yourself honestly if it was 20 seconds. I can tell you mine was, because I knew I was going to tell everyone to make sure they wash hands for 20 seconds. So practice with your kids, practice with your spouse, each way. Make sure you're washing your hands for those 20 seconds, okay? So we will update you whether through written or maybe from a different bedroom in my house. I don't know. But we will continue to update you guys and keep you posted, okay? All right, take care.